The month of December was one of the worst months in Maryland for COVID-19 infections and deaths, and the concern is that the Christmas and New Year's holidays could make January equally troubling. Joining us now is Bob Atlas. He is the president and CEO of the Maryland Hospital Association. Good morning, and thanks for joining us.
Good morning. Happy New Year.
Well, Happy New Year to you too. And with the new year comes new hope, but also some grim warnings from health officials. Where does Maryland stand right now?
Well, right now we have about 1,700 COVID inpatients in our hospitals. That number's been about the same for several weeks now, up and down a little bit around that number. But of course, we're a little concerned what Christmas holiday might have brought in terms of people exposing themselves and others. And so that should show up in hospitals in about 2-3 more weeks. And but the 1,700 that we have is a manageable number. It's a number we've had before. So not that that's a good thing, but we can handle it.
Well, and I'm imagining that the last time the numbers were this high back in the early days of the pandemic, and so much more has been learned about treatment of patients since then, that has to be somewhat good news.
Right. There are some ways of treating patients so that, we're not in crisis mode by any means, but, there are some infusion therapies that are available that we want doctors to refer their patients for before they might be hospitalized, and we could increase that. Obviously, right now we're focused on, not totally focused, but partly focused on getting our hospital workers and frontline people vaccinated so that they can safely care for everybody else.
Well, we'd like to say that's going well, but we have been reporting all morning long it's not going nearly as well as it should be going. So what's going on, Bob? What's up?
Well, our hospitals started receiving vaccines just a couple weeks ago, and they needed to do some careful scheduling of staff to get them vaccinated in an orderly fashion. Christmas came. Many of the hospitals didn't get their first doses of vaccines until day before Christmas. So that kind of got in the way. Staffing was a little lighter. And when you're vaccinating hospital people, you don't want to do everybody all at once, because if there are side effects, you don't want too many people having to be home for a day or two, and then you're short-staffed on your unit. So there's been a little bit of scheduling, planning, and all that. With the holidays behind us now, Monday, our hospitals tell me that they are going to be going gangbusters.
Oh, that's certainly good news. And have you heard anything in terms of what the reaction has been for those who have been vaccinated in the hospitals? Are we seeing a 50-50 split between those who had reactions and those who haven't?
I think the number of reactions is actually very, very low. There's due care necessary, but really nobody's being taken ill from the vaccine in any numbers that I've been hearing at all. So it's all good. And, we're starting to get second dose supplies for the people who were vaccinated 3 weeks ago this week. So that will increase the workload. But we're very pleased with what's going on in our hospitals right now. They're really excited. The staff are very excited. Some hospitals have been sharing videos of their staff encouraging one another and people in the community to go ahead and get vaccinated.
Well, that's good. And before we go, I guess I would say, what is the number one thing you're concerned about, and then end it with the number one thing you're most hopeful about?
The number one concern, of course, is the possible surge in mid to late January resulting from people getting together at Christmas. But I think we'll be able to handle it if it's not too massive. The number one hope is that, it's a new year, and we do have vaccines. I think that the vaccination program will grow exponentially, and, by the fall, at least, maybe things will return to normal-ish.
All right, looking forward to that day for sure. Bob Atlas, thank you so much for joining us this morning. Really appreciate it.
All right, thank you.